WisconsinEye's Campaign 2024 programming is sponsored by Wisconsin Counties Association, Nicolet National Bank, Wisconsin Hospital Association, Operating Engineers Local 139, the Wisconsin Realtors Association, the Wisconsin Laborers District Council, and North Central State's Regional Council of Carpenters. To support programs like this, please consider a tax-deductible donation at wiseye.org/donate or by texting WisEye to 44321.
Ann Rowe of Janesville is a Democratic candidate in the 44th Assembly District. The election is November 5th. Ann Rowe, welcome to WisconsinEye.
Thank you very much. Happy to be here.
Well, thank you for participating in our candidate interviews. What is your campaign's key message and why are you running for this office?
So the key message that guides me and has guided me, if I can have a two-part message, would be that public service is about service and not about judgment. And that has guided me since I was a kid working at a public library long ago when I was 15. And the other piece to that is that, I am interested and passionate about doing the most good for the most people with the resources that we have. And I believe in those shared values and working across the aisle with all colleagues that are going to share that priority to helping and serving everyone in our communities. So I've lived in Janesville for over 30 years. We've raised 2 children there, K through 12 in public schools. They are off and running in service-oriented careers as well. And that makes me happy. And really what I am after is that people at all stages in their lives have choices about their pathways forward. And to do that, we need to serve everyone with what we have and work together to move our communities forward.
So if you're elected, what's an example of a bill that you would prioritize introducing?
I cannot wait to vote to expand our Medicaid coverage. And with that comes the postpartum Medicaid coverage. So Wisconsin is one of 10 states, as I'm sure you know, that has not accepted the expansion of Medicaid. And with that, we are one of 3 states in the nation that has not expanded and accepted postpartum Medicaid coverage. And that is abhorrent to me. That is not helping people move forward. That is keeping a huge burden on the people who can afford it the least.
So if you're elected, you'll be entering during a biennial budget year. Wisconsin projected to have more than a $3 billion surplus. What would be your top 2 priorities for use of that surplus?
So I believe that public education, K through 12, even pre-K through 12, is one of the most essential building blocks that has been neglected for way too long from a variety of standpoints. If you look at the damage Act 10 has done to our system, if you look at just the budget cuts and the defunding and the sort of shadow funding of a secondary system of private schools, I see the results. As a small business owner working with high school students and post-high school students, I see the damage it has done. So public education, number 1, childcare, number 2. If you look at what is holding our businesses and our local economies back, it is, 2-income families unable or struggling to pay for quality, competitive childcare. And we know, going back to education, that child care experience really drives the success rates as they move forward in their education journeys as little people and then as older people. So those would be my top 2 priorities day one.
In your answer, you don't mention tax cuts or tax reform. Are tax cuts or tax reform a part of your platform in any way?
I would not support tax cuts because what I interpret or what I sense from maybe across the aisle is that any such cuts would be targeted for the very wealthiest, the ones who need it the least. And that's not where our dollars are spent. As a person with a marketing and finance background, I can tell you that strategic, proactive investment now that has been neglected will pay dividends as we move forward. That is the investment we need to make.
You mentioned K-12 education as a priority for you. It is a priority issue for many Wisconsin voters. What do you think is going well in K-12 education, and what really needs to change?
So I will tell you the dedication that I have witnessed as a consultant to the school district of Janesville for several years, that dedication, that creativity, that problem solving that our teachers and staff engage in all the time is amazing. I got to visit and hang out in so many different classrooms. So we have tremendous resources in that regard. They're not paid well enough. They are struggling themselves. They can't afford housing in our communities. And what is lacking, if I understand the question correctly, is that we don't have enough social workers, counselors, and those support services at each and every school. And remember that those workers, that staff is there for the children and the families, but they're also there for the community, even our law enforcement community. Those are active partners in helping kids avoid and respond to whatever, mental challenges that they might have. So,
what about K-12 education? Wisconsin's system of 4-year, 2-year colleges and technical colleges. What does that future of that system look like to you, and how should the legislature focus in that system?
It's critical. It's absolutely critical. So, the university system has dropped to 43rd, I believe, in the country as far as the lowest amount of funding towards our 4- and 2-year programs. That is, again, abhorrent to me and very distressing, because that is a fundamental building block for our workers and our small business owners, our future entrepreneurs. Without that building block and access to that and that affordability, we again curtail their dreams and their pathways as far as moving forward.
What do you see as Wisconsin's largest workforce development challenge, and how would you propose addressing it?
It's back to education. It's 100% back to education. So in the midst of the pandemic, we stopped building houses, but we also stopped funding and training workers in the trades, in the crafts, and in future career paths. So our pipeline is decimated of workers, and the need is even greater for those workers, and our education system is not keeping up with it. So the combination of a competitive tech school system, a competitive 2- and 4-year system, gives people, those students, options, and it builds our communities and builds our businesses.
So there needs to be more funding in that system?
100%.
Another workforce question: investments in public and energy infrastructure grow our state's economy. This provides an opportunity to invest in our state's workforce, but currently there are no requirements for hiring local workers. Would you support a state resident hiring requirement for state, local, and utility scale infrastructure investments?
To get to that, I would support the reestablishment of the prevailing wage. So prevailing wage helps businesses, helps workers, protects workers, and it provides good incentive, I think, for businesses to use ethical practices and hire at those competitive prevailing wages. And I believe that would also support hiring in-state.
Employee classification is an issue in the construction industry. Some employers misclassify workers as independent contractors or pay them in cash off the books. This lowers costs by avoiding payroll taxes and unemployment insurance, and it puts compliant companies at a disadvantage when bidding on projects. Plus, those misclassified workers may be denied minimum wage protections or overtime pay. Are you aware of this issue, and what do you think should be done about it?
I am aware of this issue, and I do believe that compliant companies are at a disadvantage because they choose to follow the rules, which is what we want to encourage. It's also about worker safety and competitive wages, family supporting wages. That has to be taken into consideration, and those are very serious issues. And those who want to cut corners, I don't have patience for that. On the other side, we can do some things to help some companies with respect to healthcare costs, with respect to education costs. So if we can work to lift some of that burden that would cause temptation to those less than ethical companies or practices, then maybe we can remedy the situation moving forward.
Affordable rental housing is an issue in Wisconsin. Some support government-imposed rent control to maintain affordability, while others argue keeping rent artificially low will decrease rental supply, resulting in increased prices. What is your sense of housing as an issue, and which best addresses rental housing affordability, rent control or building more rentals or other?
So we are not alone. This is an issue across the country as far as the lack of affordable housing. In fact, in Janesville, our local fire department lifted its residency requirement because our new firefighters cannot afford to live in the city. That is heartbreaking. We lose out as a community. They lose out on proximity. So I believe that in the other category that you offered, municipalities need more tools in their toolbox to build more affordable housing, to use the tools at hand and the knowledge at hand based on where they are as to what makes the most sense to create more housing. We are 200,000 units behind? It is a steep number. And again, we have not filled that pipeline and helped those construction businesses have the workforce that they need.
Do you have a position on rent control?
Not a fan.
Not a fan.
I'd like to know more, but not a fan because it's one piece of the puzzle.
Moving on to healthcare.
Mm-hmm.
Medical systems are facing numerous headwinds in the form of inflation, workforce development, and issues around Medicare and Medicaid reimbursement, resulting in fewer services and even the closure of a hospital system in western Wisconsin. What would you do to preserve access to care and prevent future closures?
So as we discussed, I would definitely accept the expansion of Medicare, or Medicaid, as well as postpartum Medicaid funds and monies. Those hospitals are critical to the care for the communities they serve. They accept everyone, from prenatal and beyond. They have to staff and cover all sorts of a myriad of issues in health, both preventative and acute. My son works in an ER. My husband's a pediatrician, so you can bet our dinner time conversations revolve heavily around the need for primary care services. The closures are heartbreaking to me, and that means that those communities run risk of having their residents, suffer with what is normally treatable and normally not, resulting in catastrophic health bills.
What about mental health care? What are you hearing on this issue, and how would you address mental health care?
So I'm just going to be personal once again. My husband is an active, long-time established pediatrician. He has, little people, 8-year-olds, 6-year-olds, who are in need of mental health care. The wait list is over 6 months for a provider. That is unacceptable. It's unacceptable for an adult, much less a little person. So school districts are competing against each other for the same mental health dollars. We need more people in the business, so to speak. We need more practitioners. We need more funding. We need to put those counselors and those social workers on site in the schools to ease families' troubles with accessibility and affordability.
How should Wisconsin move forward on the issue of abortion?
We need to get rid of that 1849 ban immediately.
Any limits, any exceptions that would be in your policy?
That is between a woman and her doctor.
Moving on to transportation, what are the pressing transportation needs in your district, and how important is it that these needs are addressed, and for the state to keep on schedule with the reconstruction of our aging interstates and significant corridors of commerce?
So roadways are of huge concern to the newly added 8 townships to this district. It is a primarily agricultural-driven area, and one township in particular, is looking for $30,000 to fix this much roadway to ease storm damage. So it is a topic of concern at every town hall meeting I have attended. So upkeep of the roads, we are making progress, but We have a lot of roads.
The environment. PFAS
Yes.
and other water contaminants are a concern for a growing number of Wisconsinites. Do you see this as an important issue, and how would you propose addressing it?
100%. It is a critical issue, and if we don't release the funding that was approved by a bipartisan legislature motion, other questions really become moot. So to be in the 21st century and not be able to assure all of our communities of clean drinking water is insane to me. So it is a huge concern. I want those funds released, yesterday when they were really due. And I want us to move forward in our environmental initiatives. We've got tremendous, forward-thinking farm groups. We've got community groups. We have conservation groups that really speak well to each other and work well with each other. We need all of those stakeholders at the table as we move forward.
We are to our final two questions. How would you describe the leading differences between you and your opponent?
So, my 30-year career in Janesville and prior to that includes a multitude of industries, both for-profit and nonprofit, and Fortune 500. I own a small business. I work with a variety of community groups in terms of downtown development, business development, and with that has come an accumulation, a great collection of terrific networks of people who really believe all sorts of things, and they probably subscribe to all sorts of political, beliefs as well. That doesn't stop us as we move forward and reveal our shared values as we work to move our community forward. So I have a proven track record of working with a variety of people. I enjoy people. I enjoy connecting them, and I want to serve. I believe in public service, and I believe in doing the most good for the most people with the resources we have.
Final question. Let's say you're elected this fall and you get this magic wand you can use in the state capitol to resolve one issue in a way that brings all parties together. What is that issue?
I got to go back to healthcare. I really believe healthcare is the linchpin that would move everyone forward, no matter where they are in the political spectrum, no matter where they are in our community.
Well, thank you, Ann Rowe of Janesville, the Democratic candidate for the 44th Assembly District. The election is November 5th. Ann Rowe, thank you for talking with WisconsinEye.
Absolute pleasure. Thank you.
This programming is brought to you by our generous sponsors. Thank you for watching.